How are you today?
Good, thanks.
That's good. Come in, take a seat. Sorry, my room isn't very big.
It's a pretty neat little space you got here.
Yeah, it's not too bad. So, what brings you here today?
For this assessment.
Yeah, what brings you in to have an iridology assessment?
My partner's studying nutritional medicine and starting to look into different alternative sort of medical assessments and
Yeah, cool, that's great.
and ways to nourish the body and all that sort of stuff. So
Yeah.
she suggested I pop in and have an assessment done and
Yeah.
see what we can find out.
So should be taking care of your health pretty well then?
Yeah, no, you get well looked after, that's for sure. I don't have any current real issues to sort of come and see you about. It's more, I guess we're travelling and surfing and pretty active and pretty athletic. Not like competitive level athletic, but we definitely focus on our health a lot and our physical ability for sport and so yeah, it's just a bit of a, if I can learn something, maybe different ways I can get more out of my body or look after it better, I'd be pretty stoked to learn about it.
Yeah, cool. So have you been told anything about iridology?
No, not really. Not really. To tell you the truth, I thought it was a bit more spiritual almost. So to find out that it's actually a clinical practice is a bit new. So anything you can teach me or learn from you would be cool. Yeah.
So there's a bit of a history behind it, and people do usually think of it as more of a window to your soul or something like that, as such as what a lot of people sort of say. But modern iridology is a way of looking at a preventative medicine. So we can look into the eyes and see genetic inheritances from 3 generations before. So it's quite interesting. And it's a way that you can pick up on health issues that you may already be suffering with, or might be something that you need to take care of for later on, nurture and make sure that you don't get sick.
Yep. And nurture, you mean by through nutrition or?
Yeah, through nutrition and just being aware of underlying conditions that you may be predisposed to, so that you can make certain choices in your life to avoid them. So your work or your environment, stress levels, or if you're breathing in different toxins in your industry, or general things like that, as well as making different dietary decisions, and just if you've got any issues going on, or in the past you had recurring sickness or something like that, then we can maybe be able to find out why.
Okay.
Yeah. So throughout your consultation today, I'll be making some notes as we go. So anything that you let me know, and I just need to enter in all your information as well. Then I'll get you to fill out some forms shortly for me as well, just to give consent for the assessment.
Okay.
Cool. So we'll get started here then. So yeah, as I was saying, iridology, modern iridology, is more of a preventative medicine, so like a screening tool basically. It's not a modality, so we can't actually assess chronic disease, or we can assess it, but we can't diagnose chronic disease. We're not doctors, but we may be able to see an underlying predisposition that we can then refer you onto the appropriate person, whether it be a doctor or a physiotherapist or a nutritionist, dietitian, that sort of thing. Cool. So Michael, you are how old?
32.
32. And you've never had an iridology assessment before?
No.
No. Okay, so through the assessment today, the sort of things that we're going to be looking for are genetic inheritance from, like I said, 3 generations before. So I'll be asking you a few questions about your family history and that sort of thing as well. So anything you can share with me would be great, to shed a little bit of light on any other conditions or issues or things you got going on. Cool.
Is that like an iridology joke? Shed a bit of light?
Yeah. Yeah, it should be.
It's an in-joking.
Also, any potential nutritional imbalances, so I might ask you some questions about what sort of foods you eat and that sort of thing as well. Tissue strength and weakness we can also pick up on as well in the fibres in your eyes, so if there's any loosened fibres, that sort of thing, and they're overlaying certain reflex areas in your body. Subclinical manifestations, so if there's...
You have to explain that one to me.
Yeah, so if there's an underlying condition there that hasn't yet appeared, but you're seeing certain symptoms, whether it be infections or fever or...
Okay, so ailments that may go down the track in my life?
Exactly, and it could be connected to something that's going on right now though. And so if we're aware of something that's there, then we can prevent it from happening, from manifesting. Yeah. Metabolic disturbances, so anything that's going on in your gastrointestinal system is quite a common one that we can pick up on in the iris. A lot of people nowadays have intolerances and that sort of thing, and it's overlooked, so that's something that we pick up on a lot. And any primary nurture points, as I mentioned, so things that we just need to take care of and be a little bit wary of. And also personality attributes as well, which is quite an interesting one.
Oh, so it's a psychological examination as well,
yeah,
is it?
Yeah, well, you can think of your iris as a map basically for your genetic inheritance, which makes up your personality as well. So you can see a lot of things. Yeah, it's quite interesting.
I know a bit too much about me after this.
So do you know what's involved in the assessment, or do you have any more questions?
No more questions, but no, I don't know what's involved.
Okay, so basically the assessment will be about 45 minutes, and I'm going to be using various different tools. So we've got an iris light with a magnifying glass in it. So this one, which I'll use to magnify and look into your eye. There's a little light in there, and I'll avoid shining it right in your eye, but if you do feel uncomfortable at any time, then just let me know. So that one, I can see the colour of your eye and various different patterns, markings on the eye. And then this one's a side light, so I'll shine it in from the side, and that shows up the structure of the eye, the different layers.
Okay.
Cool. So as we go, anything I see or assess, we'll stop and have a chat about, and then we'll go from there, and you can sort of give me a bit more information if anything I mention crops up and you go, yeah, I can relate to that, or build on it. Okay, so Michael, 32, and you've got a partner. She's studying nutritional medicine.
Yep.
Cool. Alright, so I'm just going to get some paperwork for you to fill out, if that's okay. If you're happy to go ahead with the assessment.
Yep.
Yep. Cool. So I'll just go grab it and I'll be right back. Okie dokie. So just the consent forms there and a few questions as well, if you can fill those ones out for me. If you've got any questions, then just ask. Cool.
Just start here?
Yep, that's it. So also, as we go through and I'm assessing different or identifying different structure types or colour and things like that in your eyes, I'll refer to the iridology chart as well.
Okay.
And also...
How's the chart work?
Okay, so I'll just give you a quick little look. So the chart is basically like a map of your iris, so showing different areas within the iris that relate to different functions or parts or organs of your body. So this is the chart here. As you can see, so left eye and right eye, and then you've got all the different quadrants, so upper, lower quadrant, and all the different...
And they're basically mirrored, are they?
Yeah.
Essentially.
Sort of, except there are some organs that are only in one eye and the other. And then, yeah, a lot of the major organs are mirrored. And then also in the head area up the top, you've got different traits and things like anxiety or coordination, those sort of things as well. They're in the head zone, and they can be a little bit different from side to side as well. But we'll go through all of that as we go, as well as the structure and the diathesis, all the things that make up the constitution of your eyes.
Well, not a lot of info to put on here. No non-existing conditions, NA.
Nothing.
Not a huge amount of sickness or illness in myself or my family.
It sounds like
pretty
you've
lucky.
been looked after then. As we go through, sometimes it's surprising. You think, that you don't have anything going on, but it might be just recurring infections or things that come and go. And also you may be familiar with a trait or something that your grandma had, or whether it was that they were really highly strung or they were really cool and chilled out, or things like that can show up in your eyes as well of generations before. So
what's the date today?
The date today is the 14th.
Just got this assessment done in the nick of time.
Yeah. Yep.
Okay, that one's done.
Cool, excellent. I'll just have a quick little read over that one. Beautiful. Okay, I might just pop that one over there beside you, and one there too. Okay, so first of all I'm going to have a look just at the colour of your eye. So sometimes you might have mixed colours and things like that, and it may appear that it's blue, but when you actually look into it, it could be a mixed colour, so you might have a little bit of brown or green in there as well. Okay, so I'm just going to get you to look directly at my forehead, and I'm going to hold the light in on your eye just for a couple of seconds, and I'll get you to raise your eyebrows so that it opens, exactly up your eye nice and wide, and I can see all the way in.
Yep.
I'll have a quick little look, and then we'll talk about what I can see. Cool. Okay, so just focus on here for me. Yeah, and I'm just going to come in and have a look here. And then I'm going to go and do the other eye. So just focus on my forehead there and raise your eyebrows. Beautiful. Lovely bright blue eyes. Okay.
Thank you.
Cool. So the iridology term for blue eyes is lymphatic, and some of the underlying conditions experienced by a lymphatic is...
So that's what you mean by the colour tells you that.
Mm-hmm.
And lymphatic means what?
Lymphatic relates to your lymphatic system. So a lot of issues that lymphatic type can have are related to the lymphatic system. So elimination of toxins in the body, whether it be through breathing in substances or eating different types of food and it hasn't been broken down properly metabolically, or chemicals and things that you're exposed to, sickness
like glands,
as well.
right?
Yeah, your glands. So glands in your neck, you might feel when you get really sick that they come up, or underneath your arms, sometimes you can feel little lumps and things like that. So we'll go into a little bit more detail anyway, because there's also personality traits and all sorts of things that are connected to the lymphatic type. And as I said, I'm just going to make some little notes as we go as well.
I'll keep filling out this form then, eh?
Yes, that'd be great.
Eyes colour, blue.
Lymphatic. And I've got the pictures that you sent in of your eyes for me. That's great. Your girlfriend did a really good job of taking those photos. It's hard to get pictures of the eyes, so I've got a few notes that
Especially when we're wobbling around on the boat as well.
So I've got a few notes there that I've made from the photos as well. So it'll be interesting to see whether any of that is relatable to you. So generally for the lymphatic type, some common complaints are as a child, ear, nose and throat problems. So you might have experienced ear infections or tonsillitis, swollen glands, cyanitis in your nose, lots of mucus formation, that sort of thing. A lot of toddlers that are lymphatic generally have, if they do have those issues, have grommets as well, because they've got so much mucus build up.
Grommets?
Yeah, so they're like, little moisture absorbers basically that they put inside the ears, and it absorbs the excess mucus and build up in the middle ear.
We were surfing in cold water and sailing in cold water a lot, and my dad had to have like a surface ear, the bone growth over in his ear, so I guess maybe we're susceptible to that. We've always he was always like hammered us in as kids wearing earplugs in the water and stuff like that, and we were reasonably careful with our ears, so I haven't had to have, he actually had to have his drilled out. I haven't had to do that yet, so maybe is that something that might be
maybe something definitely to look into.
Linked to what you're saying there, like more susceptible to the cold maybe, or?
Yeah, definitely more susceptible to cold.
A lot of people that get them start getting ear infections after that because there's moisture getting trapped in there.
Yeah, exactly. But also, like as a child, did you suffer with any ear infections? Like, sometimes where you can hear like your heart beating, or it feels a bit cloudy in your ears, or when you swallow you can hear like a clicking noise in your ears, they're all blocked, that sort of thing. Or when you just have a general cold.
Yeah, not through ailment so much, but just like maybe through injury, it would be more when we've had problems.
So more through water, cold water and surfing and that sort of thing.
Knocked them and hit them and maybe slapped, not burst your drum, but inflamed it a bit or something like that.
Yeah, okay, cool. Well, that's good. The other thing I did notice about your eye structure, we'll go over structure in a minute as well, but just quickly on that one, is that you're quite resilient. So the closer the fibres are together, the more resilient you are. So meaning that you're less likely to be susceptible to certain sicknesses that you might be.
Illness resilience.
Yeah, exactly. And also just general resilience in your body, so muscular tissue and that sort of thing. Yeah. So which is good. It means that you're less likely to get sick.
I'd say normally I would agree. Like I have had one cold this year, but normally it's pretty rare for me to get the man flu or anything.
Yeah. So you're less likely to get sick, and if you're looking after yourself, then you're generally pretty healthy. Yeah, which is good. So some other common traits of the lymphatic type or complaints, like I said, is sort of the mucus build-up, so hypersensitive mucous membranes, and it might not be necessarily something that you've experienced at the moment, or that you can really think of, but when you get sick, if you do have a sinus infection or something like that, then it's something you need to be aware of and take care of. So nourishing your mucous membranes with certain dietary foods and that sort of thing. Also quite common are skin conditions, so they can include eczema, dermatitis, acne, anything that's sort of like dry and scaly. Yeah. So have you experienced any of those sort of
definitely suffered from eczema here and there, different stages.
Yeah.
Got worse and not so bad at different stages through my life. Very late teens probably when I had the worst.
Yeah.
More sweat related, I think, like in the backs of my wrists and backs of my knees.
In all the joint areas.
Yeah, exactly.
It's generally where it
if you got it on this side, you got it on that side, sort of thing, like parallel style.
Exactly. Yeah. So you haven't had any eczema of more recent years, or skin irritations, itchy? I did notice actually around your eyes at the moment is a little bit dry and
I've been in the salt water a lot lately and the sun a lot, and I've got the tops of my eyelids and getting a little bit dry and peely just out to the sides there.
Yeah.
I haven't really figured out whether it's sweat or salt water or a bit of both that's causing it. I'm just trying to put a bit of moisturiser on it at the moment.
Yeah.
I haven't started using a steroid cream or anything like that, but I used to with backs of my knees.
With the eczema. Yeah.
Yeah.
If it's not spreading, then it may not be necessary to use and it's not really itchy and inflamed, then it may not be necessary to use a steroid cream. There's certain oils and things that basically you want to get the hydration in there. So certain oils and things that might be a little bit more suitable, especially around the eye area, because it's really sensitive and you do absorb a lot in that area as well. So if you can avoid the steroid creams, then that's good. But keeping up the moisture to them, and like you say, you're in the sun and the surf, then keeping the moisture up will just help protect them. So maybe more of an oil-based product. So also some food types and different substances can inflame those eczema and skin conditions as well in a lymphatic type, and they're generally dairy products, as well as flour and gluten can be an issue as well. They're basically mucus forming foods, sugar as well, refined sugars.
Okay.
So they're the sort of foods that...
I guess all of those things are in my diet. I guess we
Yeah.
maybe try and eat them in moderation where we can. We don't
Yeah, you don't eat
excessive of any of those, but
Yeah.
yeah, definitely haven't removed any of them from my diet altogether.
Yeah. Do you notice any, like say if you do happen to eat more of them, I'm sure probably with your partner studying nutritional medicine, and she's probably aware of certain sensitivities and things like that with eczema and that sort of thing, that she may have removed them from your diet slightly. But if you do consume more of them, do you notice any...
With the skin condition in particular? No, I'm not too sure about that.
Really sure
Maybe
about
just
that?
dehydration,
Yeah,
as long
not
as you're
drinking
hydrated. Seems
Yeah.
to be a big difference.
And what about gastrointestinally, like if you eat too much sugar or too much flour?
Maybe more flour. If we go out and have a big pizza feed or something like that, it's a bit hard to tell whether you obviously wake up really early in the morning. I've had a few problems where I need to get up and go to the toilet earlier than I would normally do if I'd have a big feed.
Yeah.
On doughy sort of stuff, but it's hard to know whether it's because you've eaten a heap of food or whether it's because your body's maybe not rejecting.
Yep. So the reaction that you get generally from eating too much flour or gluten is sort of the need to urgently go to the toilet.
Yeah, I guess by the time I get around to going to the toilet, there's no holding on. Like it's time to go to the toilet, so there's no messing around.
Yeah.
It's not like it's not like diarrhea. And I don't think it's the consistency of your motion that's the problem. It's just
an urgency.
It's urgent, yeah.
Yeah. And so what sort of foods do you generally find that might happen with? Can you think of any off the top of your head? More recent times, or?
Usually pizzas or something like that,
Yeah.
Or when we've gone out and had a big feed. But yeah. It'd be interesting to know, like if you did like a curry or something, maybe that didn't have. Generally, when you have a curry, you eat a lot of naan bread or something as well, So.
Yeah.
Well, maybe I'd have to concentrate on it to sort of eat some less wheat-based foods and have a big feed of those and see if I had the same reaction like you said there.
Remove them from your diet and see if it makes a difference, and then if you slowly introduce them, see if you notice the symptoms again.
Mm-hmm.
Yeah, it's definitely a way that you can test for intolerances. As well as having specific sort of intolerance tests as well through blood tests and that sort of thing. Cool. So I might just write those little notes down quickly. So it could be a slight sensitivity to gluten potentially. So something to be aware of. Do you have any family history or any brothers or sisters or mum or dad that may have any gluten intolerance or dairy intolerance, gastrointestinal issues?
My mother has not too long ago been diagnosed with Crohn's disease, and she actually had to have part of her large intestine removed.
Mm-hmm.
And then part of the management of that now is she's cuts back on her dairy and gluten stuff. She's not a full celiac, I don't believe, in terms of no wheat.
Yeah.
But she's definitely
with
irritates her condition. I think if she has particularly dairy.
Yeah. Okay.
Too much dairy.
Yeah. So that's a common sensitivity with Crohn's disease. It's an inflammatory disease, so foods like dairy and gluten can aggravate it. Peanuts and soy and stuff like that as well.
Yep.
So yeah, but that's good to know that something maybe to be aware of as well, just to stay on top of. And if you do have those sudden needs, urgency to go to the toilet, then if it becomes more common, then maybe get it checked out with that family history of Crohn's. It's something to be a little bit more careful. It's like I said, an inflammatory disease, so it's your immune system overreacting. in your gastrointestinal system. It's actually inflamed areas of your intestines, so it's something to just be careful of your immune response and that sort of thing, and be a little bit more careful of it.
Definitely something my family sort of encouraging me to be conscious of as well, so
that's good.
Make sure we're looking for changes, and
if
anything starts happening, to pick it up early.
Yeah, cool. So just back on the common complaints for the lymphatic eye type, so blue, that you may not have experienced, maybe you have, is upper respiratory issues, so like bronchitis, tonsillitis, asthma, which is quite often connected with the eczema type thing as well.
Okay.
When you sort of might have a cold or sickness, you might notice swollen glands in your neck or in your groin area, the back of your head, or sometimes they just pop up for no reason. You know, you feel like you've got a sore neck and you feel it and your glands are up, or your headache and your glands are up.
I went and got checked out a few times when I was in my middle teens, I guess, for got sort of lumps in the gland areas, throat, back of the head, and in the sides of the groin there.
Yeah. So they were popping up and
just a little hard sort of bump or
there.
lump or something, and got it checked, and the doctor was just like, no, it's normal, don't worry about it. He didn't really give me much of an explanation or anything, just said, don't fuss about it, you know. Yeah,
it's just your lymphatic system sort of kicking into gear if there's something there that it's trying to fight off, infection, or maybe even just something sensitive to food-wise or something like that. So again, just if you do feel those sort of symptoms, then it's good to be aware that maybe you are fighting off something too, and if it keeps reoccurring, then something to be wary of. Alright, so we're going to move on next and diagnose, well, sorry, not diagnose, have a little bit of a look at the structure of your eye, and then we'll be able to see the different layers and textures of the fibres and things like that. So for that I'm going to use a side light, so this one. I'm going to shine it in at the side here, and I'll just rest it on your face there, like that. Both eyes for a couple of seconds. If it's irritating at all, then let me know. And again, I'll just get you to focus on my forehead there, and maybe raise your eyebrows so I can see the whole iris. Yeah.
Try and open up my eyes all the way.
Yes, exactly. Cool. So we'll move on to that now. Alrighty. So I'm going to come in there nice and close, and I'll just get you to focus on here for me. That's great. And just have a look here with the magnifying glass again. That will work there. Cool. So it's a little bit going on in there. It looks so much different when you get this side lighting in. You can see a lot more than the photos that you sent in. The photos are great, but this just lets me see all the different layers there and brings up some different textures in the eye. Great, that felt okay?
Yep.
I'm just going to have another little look.
Yeah, it wasn't too bright.
Not too bright. I'm going to have another little look in this left eye here. So I'll just get you to focus on my forehead again. I'm going to get you to raise your eyebrows right up. That's it. Perfect. Cool. Great. Just let your pupils go back to normal there. Okay, so we'll talk a little bit about structure then. So I did notice before even using the light, when you first came in with your eyes, you've got quite small pupils, which is part of your structural makeup of the eye as well. And you can actually tell a lot from the pupil too. Other than that, like I spoke about the resilience in your eye, the texture of the fibres is quite close together. There's only some sort of more separated fibres around the sort of middle section, which is your collarette, so just outside the pupil border, with some lacunae, which are just little gaps, openings in the fibres, and when there's shading in those areas, it can be picking up on certain reflex zones, so organs or tissues in the body that may have a little bit of weakness in that area, or maybe predisposition to something, a condition or So we'll talk about family history if anything pops up in there. I also made some notes on your pictures that you sent in too, from some structural things that I could see as well. So, and I noticed the pupils there too. So it's quite interesting just to find out what those things mean and if you can relate to them. And like you said, you're just interested basically to see what iridology is about. So you're a pretty healthy, fit young guy. So we'll just see what we can learn from structure. So as I was saying, with the iridology chart, if something pops up in a structural area, then it might be on a reflex zone, and we can discuss then if you've had any family history or anything you can relate to in that area. So a small pupil is known as mycosis, and generally some interesting personality traits can come with this one. So maybe we'll talk about that and then you can see if it relates to you at all, because that can be kind of fun to do. So emotionally, this can indicate an attitude where nothing but the best will do. So you might always strive to do really well, have a bit of a rigid structure for your emotions, and can be a bit of a perfectionist at times. Always strive for your goals and want to get things done. Does that sort of, do you feel like
yeah,
that
I guess I
fits
can
you at all?
relate to those a little bit.
Yeah.
Like to get things done right and probably in my own way, and I guess not sure whether absolute perfection, but definitely how I would like things done and
yeah.
followed through with.
Yeah. So sort of in your life, you know, is there any particular goals and things that you've set for yourself and you've achieved them, stuck to them, and
yeah, I've
that
had
sort of
some
thing
challenges
you
in
can
my life
relate
that have taken a while to work towards, and had to really sort of sacrifice a lot to make them happen. So
yeah.
I guess I can relate to that.
Yeah. And what would you? Yes, you did mention that you live on a boat and that you.
Yeah, that would be the main one for sure. We I built that boat over 6 years, and we put thousands of hours of work into that. So that it was a big project to manage as well, you know. So
yeah.
had a lot of financial pressures and stress that came with it, and relationship issues and all sorts of things during that course of time. So.
Yeah. And what about your career as well? Do you find that what do you do for your job, in fact?
I work on a construction ship. So I guess in a sort of general terms, I'm doing fly-in, fly-out work or shift work.
And what's your role on the ship?
Construction manager.
Yeah, and in like
The
manager.
shift supervisor, so responsible for the productivity and the safety of that shift and the operation of the vessel during that shift. So I guess it can be a sort of high pressure job and some time constraints and financial pressures as well to make sure we're doing the work we said, kept everything rolling.
Yeah.
So
And how do you find?
it's definitely a bit of a pressure cooker of a job, I guess, when it can be at times at least.
Yeah.
And then you've got all the sort of emotional pressures of fly in, fly out type work, and then the pressures on your body doing the shift work as well. So.
And how do you
bit
find
going on
that
there, I
you
guess.
cope with that? With it'd be a very sort of being in charge of and managing a team can be quite stressful at times, like you mentioned. And how do you find you sort of manage those stressful times?
Just concentrate harder usually to work your way through your problems, but I guess the main worry is not knowing your teams and having to sort of not yes. The most of the pressures can come from when you're not having faith in some of the crew, that maybe because you don't know them or maybe because they've let you down previously. So you're that's where like you can have to sort of put more effort into certain areas than you really should. And
yeah. Okay.
try not to micromanage as much as possible would be the main.
Yeah. So work your way into that sort of role. I'd say that personality type sort of fits you really, because you do have to be a driven person and motivated and, you know, push yourself a little bit to be in a position like that and manage a team.
Mm-hmm.
Yeah. So your structural type, so there's certain things within the iris structure that put you into a type, a constitutional type, and there's 6 different types to sort of fit into.
Okay.
And from the photo I assessed that, and then just having a little look now, it just confirms what I thought where you fit in. So I think you're a neurogenic type, which is here. So some of the things that you may see in a neurogenic type are also very similar to the personality type traits that I was just talking about. The neurogenic type is also seen to have that small pupil as well. So you may be always on the go. This can be really good, like you're always busy, wanting to keep busy, but also it means that you can get drained or tired or stressed out or burnt out as well. So something maybe you should be aware of too. Do you ever feel like you're taking on too much, or you get to the point where you've taken on too much with your job role?
Not so much taking on too much, but probably push myself hard to sort of finish everything, and I guess it could be called that. Like I still manage to see everything through, but sometimes that might involve sort of late nights or getting up early, or never lack of sleep. Very, very rarely lack of sleep, but just wake up pretty early and get back on with it and finish up what you want to do. And
you're a go-getter and a hard worker and a doer. Yeah, that's good. So with the neurogenic type, one of the predispositions or nurture points is your nervous system. So something, again, just to be aware of. It sounds like you handle it pretty well, the pressures of work and that sort of thing, you're onto it. But yeah, the nervous system is a point where you need to nurture. So if you ever do feel like you're
saying like stress build up or something like that?
Yeah, stress build up, or pushing yourself to exhaustion, because that's sometimes what that personality type can do. You take on a lot because you enjoy it and you strive to do well and you thrive off the motivation of doing it. But you just have to be careful that you don't push yourself to sort of mental and physical exhaustion there as well.
Understood.
Yeah, cool. Also, the neurogenic types tend to use up nutrients at a higher level, and that's sort of related to that nervous system thing as well. So your nervous system might be working overdrive because you tend to be a person maybe who goes non-stop and works really hard. So it puts more pressure on your nervous system. So the nutrients that you may use more of are calcium and magnesium. So that might be something maybe your girlfriend who's studying nutrition
can help us with.
Yeah, or look into.
Be a challenging one, like for example, like you mentioned earlier that because of the colour I could be sort of dairy intolerant slightly or something like that, but at the same time I need more calcium as well, so that's going to be a bit of a challenge to
so you can get your calcium intake from a lot of other foods other than dairy, and there's a lot of other substitutes as well for dairy, other milks that have that calcium in them too, as well as nuts and seeds and different foods that are high in calcium also.
Okay.
Yeah. So you can definitely work your way around that, and she'll be able to help you out with that. Or if it gets to the point where you maybe do have an assessment, and I recommend might be another thing that you'd like to look into is a nutritional assessment to figure out if you are deficient in any particular vitamins, minerals. Like we spoke of, magnesium, calcium are common ones.
Yep.
If you're in a highly stressful environment, or working shift work and that sort of thing. With your nervous system, you may have different symptoms like twitching or cramping, that sort of thing. Do you get any cramps or
occasional cramp
or twitches
during
in your
sort of
eye or things
exercise
like
and training and stuff, but it's usually only when I've sort of had a big night or neglected my body.
Yeah. Okay.
If I keep myself hydrated, then
hydration's a big one. Yeah. Cool. So lastly, I'm just going to assess any accumulations or deposits on your eye. So it's called your diathesis, and it's probably the most primary constitutional type to be aware of. Okay. So I'm going to use the iris light again, the same as before.
Yep.
And I'll just get you to look straight at my forehead again. Alright. So just doing your left eye there. Cool, just raise the eyebrow. Beautiful. Good, and I'm just going to have a look at the right eye now. Same thing, just focus here for me. That's it. Good. Excellent work. Not too bad, pretty painless.
Very painless.
Okay, so from the photos that you'd sent in, I could see a lot about your diathesis as well, but it was just good to have a look with the iris light there and confirm those things. So I'm going to show you your photos too and go over a couple of the accumulations and spots and markings that I saw on your eyes there. So from those, I've determined that you are a hydrogenic type, and we'll go over the common signs and symptoms of that too. So here's the photos of your eye there, and we'll go over the iridology chart to have a look. So you can see here the major things that I can see, and you may have noticed yourself in the mirror or when you're looking at the photos that you sent in. This orange spot down here.
Okay.
Yeah, so nothing majorly, to worry about, but it's in a reflex area that maybe you've had some symptoms, or maybe there's some family history in that spot.
Okay.
There's also some brightened fibres, which mean that it could just be an area that you need to nurture a little bit more, that there's not as much nutrients or oxygen getting to that area. So here the orange spot is lying over the urinary bladder, and with the lymphatic accumulation that you can see around here, sometimes it's white, sometimes it can be yellow, orange, and the colour determines sort of...
Which one are you pointing at there?
The lymphatic. So these little dots that you can see in the exterior, they're those little yellow
around the edge
dots.
there?
Yeah, exactly. So they're called lymphatic tophi, so it's just little build-ups in the lymphatic system, the elimination system. And the colour of them can determine sort of whether they're more toxic or what the issue may be.
Okay.
The underlying.
So how does the bit around the edge relate to the orange dot there?
Okay, so your orange dot is lying over the urinary bladder system, and then we've got this lymphatic tophi around the outside, which is your elimination system, and that's yellow. So the yellow represents the kidneys, which is related to your urinary bladder. So there could be something going on, a connection there between the two. Maybe your kidneys aren't eliminating toxins, or they could be working absolutely fine, but something that maybe you need to be aware of as a point to nurture.
Okay.
Maybe there's some family history there of renal issues.
Okay, yeah, I'm not too sure about my own family, but I did have a period in my life when I was in my teens where I had several urinary tract infections, and it was a bit rare for a boy to get them, so the doctor was definitely keeping an eye on me for a bit there.
Okay, yeah.
They knocked me around pretty good, but then I just, it was only for a few months, and then never suffered from them again.
Yeah. So that it was a period where they just kept coming back?
Just a couple of times.
Yeah, infections.
But they knocked me around pretty good.
Yeah, okay. And did you have to take courses of antibiotics for those?
Yeah, I believe so. It was a long time ago, but I believe I was medicated.
Yeah. And of more recent times, haven't had any issues?
No.
No. More onto it now with hydration and
probably.
That sort of thing. Yeah. Cool. So again, maybe something just to be aware of, to be a little bit more careful. You've suffered with them before, so you may be a little bit more aware of that you just need to stay hydrated. Other things can provoke that, like alcohol, acidic foods, stress, and that sort of thing too. So a way to stay on top of it. Also with the neurogenic diathesis, some other little things to point out, common complaints, is the chronic lymphatic congestion. So that then ties in with your colour as well and the structure. So chronic lymphatic congestion can sort of have symptoms like those intolerances to dairy and wheat and sugar.
So they're all kind of lining up. That's the different things you're looking at there.
So the mucous membranes and the build-up of mucus, maybe cyanitis, those sort of issues, they're all
I've never suffered from any dairy-related sickness or anything, but it'd be interesting to see how it would go if I did remove it from my diet.
With your eczema and stuff like that, or your irritated eyes, it'd be interesting to see if you remove those things, if it made a difference.
Okay.
Yeah, for sure. So some other little things that I've noticed there were, and I can show you on the chart and in the photo as well. So some other specific markings. We spoke about the lymphatic trophy. So those underlying conditions can be exacerbated by a sedentary lifestyle. So if you're not exercising as much, so you might find sometimes at work, if you're sitting a lot of the time, how does that make you feel? Do you feel better in general, like you have more energy when you're moving and exercising?
Yeah, I guess I'm a pretty active person, so yeah.
At work, you exercise as well?
Yeah, I guess so.
Yeah.
I have had a couple of periods in my life where I've been office bound for a while, and my body does seem to slow down pretty quickly. So if I'm not exercising, then yeah, I kind of come off my fitness pretty quick, I think.
Yeah. So it's a common sort of feature, I guess, with neurogenic types to feel a bit sluggish with that congestion, and a way to get the lymphatic system working and moving is through exercise. So if you are feeling like your glands are up or feeling a bit sluggish and tired, exercise can be a way to sort of refresh and make you feel good. Yeah. The other thing was a bit of shading. So in your left iris, there was shading in the upper quadrant, so I can show you that one as well, between 45 and 60 degrees. So we break up the iris chart there into degrees around the side. So if we're looking at your left iris there, there was some shading in the respiratory area. So although you might not be having any respiratory issues now, it's just a sign that there may be some weakness there, and upper respiratory is related to that sinusitis and bronchitis and those sort of things. So you may be fighting fit and healthy, but something that you need to again nurture.
My father had he's a commercial fisherman, diver, and he has a Barrett's esophagus, so he's had some, I guess not so much respiratory, but in that sort of throat issues as well, and he's got a bit of cough he gets every now and again. When he was working on building the boat, some of the products we use with the boat building, the epoxies and the paints and stuff, used to irritate his respiratory system, and you have a little cough.
Yep. Okay.
Repetitive short cough he'd do all the time.
Okay. Yeah. So a tiny bit of respiratory history there. Okay. Interesting. So I think we can probably wrap it up there for today.
Okay.
We could go on and on forever with the different things you see in your eyes, but you just wanted to come in and give a little bit of an overview and an idea of how it all works.
So what would you say my main take homes would be, or things I could try to...
Yeah, so main things that I've jotted down here for you to sort of focus on would be all of those constitutional types come back to the mucous membrane. So keeping your mucous membranes hydrated, making sure you're keeping your fluids up to your body so that your lymphatic system can work properly to flush things out, and that you're not going to get dehydrated. As well as with age, the likelihood for inflammatory issues, including arthritis, and your mum had the inflammatory of the bowel, which is more immune based, so taking care of your immune system and trying to calm down those inflammatory responses to prevent any sort of digestive issues. So taking care of your immune system through nutrition, making sure that you're eating plenty of fruits and vegetables in the diet, and maybe eliminating anything that you do find you have intolerances to, like the wheat that you find sort of brings on those urgent bowel movements. Just as a bit of a test, maybe take it out and see how you go. If it gets worse, if it feels like you're controlling it at the moment and it's okay, if it gets worse, then maybe it's something to look into. Regular exercise, fresh air and sunshine is what your type can...
Definitely got those covered. Too much sun around here.
Yeah, and is what you sort of thrive on and feel better when you're in those conditions. If you're stressed and you get out and get some fresh air and some exercise and some sunshine, then you probably feel automatically relieved and healthier already. Just with the exercising, with maybe careful you don't overdo it. If you're the sort of person who pushes yourself to your limits, you might find that with the inflammation as well, it's common to get inflammation in joints and tendons. So if you're overdoing it and pushing yourself to your limits, you might get certain, shoulders or knees, that sort of thing. So just being aware of where to stop.
Okay. I've definitely had a couple of injuries, both the places you mentioned there actually, over the last couple of years.
Yeah. So from
all over exercise or injury, sport injury.
Yeah. So just knowing your limitations and being aware of it would be another little pointer I would just say there. And with the respiratory issues as well, you did notice that your father may have had some underlying respiratory issues there, and it sort of pops up in a couple of the markings on your eyes as well and your constitutional type. So just avoiding any environmental substances or irritants that could cause issues later down the track. You maybe feel fine now, but in your industry you probably aren't so much exposed to chemicals and things. But
can be at times, but just try and protect ourselves. We do pretty good use of the protective equipment and stuff. So.
Yeah, and you're a non-smoker?
Non-smoker.
Yeah, I saw that on your paperwork there, so that's excellent. So again, just keep doing what you're doing as far as looking after yourself. You came in today with no issues, and we've sort of talked about a few that have popped up there of old illnesses and things like that.
Well, it's interesting, you see things in all the stuff that you saw on mine of somewhere in my family or myself. We've got some not so and some more, so had issues with them previously, so interesting.
Yeah, but other than that, you're doing really well. Sounds like you're fit and healthy and your girlfriend's looking after you.
She sure is.
Cool. Well, I hope you enjoyed your assessment today and learnt a little bit from it.
No problem. Thank you.
If you want to discover any more, come back and see me.
Alright, See you next time, Doc.